There's just, before I get into it, just one thing to mention is, Michelle was saying that people are kind of in different places. I thought about putting this in, but I didn't, and I'm glad I didn't. I'm not going to expect you to know it. But there are developmental stages that people have looked at for spiritual development in the world. Just like, we grow up and we go through different developmental stages to become adults all the way to the point of being an old person. There are stages that are defined for spiritual development, and people can develop, all the way to the last stage. But what's true about spiritual development is it can stop at any point too. So it's not like we're all going to grow through the various stages and when we get to the end of life, you're at the same place. There's a growth or an orientation, and then it can actually be arrested and stopped. So it's one of those developmental things that doesn't have to happen, but it could. So when you're talking to people and you're really getting into spiritual assessment, which I don't expect you to do, I just want you to appreciate what it is and how it fits in. The discussion would get into things to help that person understand, that practitioner understand, where is this person and how do they actually view spirituality in the larger scheme of things. It's a big area of research right now, kind of interesting. So why do we look at this stuff? Interest in spirituality and aging is really increased lately. I would say in the past 10 to 20 years, there's just tons of research. It's really interesting to try to research on something that's hard to hold on. Mostly because there is a lot of evidence that you have a positive health outcome when spirituality and religious orientation is factored into the equation. Okay, so there's quite substantial evidence out there. We're not talking about miracle healings necessarily, but we're talking about how people hear, receive, behave, respond, and how they feel, all throughout the process. You could look at it somewhat from a psychological perspective, a psychiatric perspective, but really it's a spiritual perspective that has impact in other realms, of existence. The fact that people are living longer, they got more time to think about stuff, and so we have more people who are getting older and they are confronted with lots of loss, physical illness, and their impending mortality. It's not as different as it was. Everybody ages and dies. That's been happening since the world began, but we are living longer to have even more losses, and so that creates somewhat a crisis for some people who they are. If you live to be 90, you've probably lost all kinds of people, and it's not unusual for 90-year-olds to have no one that's their contemporary living, husband, even children, and all their friends. So they might really feel like, why am I still here? This would be a good question. Okay. Integrating an individual's spiritual practices into healthcare can help shape personalized medical care for older adults and improve their health outcomes. So that's why it has kind of come up onto the radar screen, one I want you to be aware of. Now, but there's barriers to spirituality assessment, and some of those have already been mentioned. First of all, lack of training for healthcare professionals. Nobody teaches you how to do a spiritual history. Nobody talks about what to do with it. And for heaven's sakes, there's so many traditions. How would you actually even begin to get into it? It's kind of daunting when you look at it. Shortage of time. You have 15 minutes, and you have to kind of get them from here to there and keep them moving. Any question about spirituality just opens the door. It just becomes very difficult. So you have to have focused time to do it. Now, I would say people in nursing homes, assisted livings, long-term care facilities, there's more time for dialogue with different people. But in a primary care practice, you're going to have episodic relationships. And if you're within the practice long enough, you'll have a bunch of episodes. Eventually, you begin to learn stuff about people. In all the patients I saw, I had people I'd seen for almost 20 years, just on a regular basis. Those people you actually kind of know. But it's just all the various ways you talk to them over time, you kind of put it all together, you kind of learn them. But shortage of time is a real issue. And then the final one is just discomfort for healthcare providers when discussing spiritual issues and needs. Kind of like what's been said here. Don't know what to say, don't want to hurt them, don't want to be too aggressive, don't want to be too distant. You don't know what to do. Okay, let's look at this little video clip. That'll work. Probably doing something real weird. Didn't work. I went too fast.
Spirituality comes from the Latin word spiritus, which means breath, courage, vigor, the soul, life. What words come to your mind when you hear the word spirituality? What feelings are evoked within you at the mention of this word? How can spirituality be defined and described? And what importance does it have for health professionals? This video program will look at spirituality, how it is expressed and nurtured, and the implications for health professionals. Spirituality is a well-recognized phenomenon in all cultures. In recent years, there has been increasing attention devoted to spirituality within the healthcare literature. What is evident is that there is a variety of meanings attached to the word spirituality. As Carson and Stoll maintain, spirituality can be an elusive word to define, and we struggle to define it. It is difficult to encapsulate in words.
Well, spirituality, for me, is, I guess, it's so hard to explain, really difficult to explain what it really means to you. But the nature of art, for instance, is about spirituality. Art itself deals with an area that is almost impossible to explain exactly what it is.
For me, spirituality is a presence of, I have to say, a God-like presence, but maybe not always. Sometimes it's the presence of someone else who is affecting my life in a positive way, kind of networking. But spirituality is something that gives me a feeling of constancy. And I don't think about it often, but I am aware of it most of the time.
For me, spirituality is inner life. It's being in tune to what's going on within you, knowing how that affects others, and being in harmony with family, with the world around you, and with your conscience.
Spirituality, I think, is an awareness of how we are connected to a greater being or a greater purpose, I think, within the universe. It causes me to question our very existence of what we're here, of why we're here, what our purpose is.
Spirituality is something that I think most people have their own definition of, and you often hear people say, I'm not religious, but I'm spiritual. I guess it means a connection with other things than the world, maybe as we see it, the physical world. And also a connection of people's, or you could call it spirits if you want to, or just people in general, that seems to exist. And even after someone dies, you can still feel that connection with them.
Being a Muslim, I identify spirituality closely with religion. A lot of what I do as spiritual acts actually stem from religion. The spirituality means to being connected to higher being, being connected to, to a superpower that actually gives me, give me personally, a day-to-day energy to maintain, keep doing what I'm doing.
6 different people, 6 views of what spirituality means to them. Nature, art, presence, a feeling of constancy, transcendence, harmony, religion, and a connection to self, others, and a higher power. These are all themes that you will find if you peruse the healthcare literature on the concept of spirituality. And they are the themes that you will encounter in the words of clients with whom you work. One way to describe the concept of spirituality in terms of its connection to health is to think of it as part of holistic care, a central concept in healthcare today. Using the analogy of the mobile, there is a physical component, an emotional component, a social component, and a spiritual component to personhood. When all of these components are in balance, it contributes to a sense of well-being within the person. But when illness or some other significant life event occurs, the balance can get thrown off, and the person seeks to restore a sense of wholeness again. In a sense, spirituality is not just a component of personhood, but it is the central artery, as one nurse author describes it. That is, spirituality is essential to keeping the balance. It restores balance so that a person can be physically unwell and yet be healthy. Narayana Sami, a nurse educator in Great Britain, captures the essence of spirituality well when he says, "I see it as my being, my inner person. It is I who am unique and alive. It is expressed through my body, my thinking, my feelings, my judgment, and my creativity. My spirituality motivates me to choose meaningful relationships and pursuits. We desire for personal quest for meaning and purpose in life, a sense of harmonious relationship or interconnectedness with self and others, nature, and ultimate other, and other factors which are necessary for our integrity." A common expression of spirituality is by way of a commitment to and the practice of a particular world religion. Reflection on the commonalities and differences between spirituality and religion is important for health professionals, as there can be significant implications for client care. For example, if the healthcare professional only equates spirituality with religion, then he or she is operating from a narrowly defined view of spirituality that neglects broader aspects, such as transcendence and relationships. Spirituality is common to all people, the integrating aspect of the self. Religion, however, can be seen as being under the umbrella of spirituality, namely a particular expression of spirituality that has to do with specific beliefs and practices that are usually shared in common with others of that same religious community. From the client's perspective, his or her spirituality and religion can be so intricately connected that they are one and the same, an important point for healthcare professionals to remember.
Prayer is definitely the number one action that I actually do to help me with my overall well-being. It's important because I get connectedness through prayer with the higher power that actually, which is sustainable, that helps me conduct daily activities, helps me do what I do at a time of problem, at a time of affliction. I resort to that to prayer as an action. I also get spiritual through the reading of the Holy Book, the Muslim Holy Book. Muslims actually worship in a mosque or in a masjid, and like many other religions, actually, there is a time where everybody gathers for prayer. And that's when you actually meet new people in the community. You meet your friends, you meet sometimes family. So,
That's enough. That's where I want to get to.
Spirituality,
Okay, so you heard some of what they were saying. It's really not any single thing that anybody can put words to, but it actually is very important. There's one thing in that video clip I think is most important of all for you to take out as a healthcare provider. It was the issue of balance. That issue that you have physical problems that need to be attended to. There are social problems that need to be attended to when you're with a person. There's financial issues. There's, sense of self, but also this sense of spirituality. Each person will have some sense of that within that you may or may not know what that is. And if it's in conflict with what's going on, or that part is not in harmony with the rest, it's very difficult for that person to feel well. So if it's completely ignored, you may be missing the one thing that puts it all back together for them. And it's their way of defining their reality of being okay. Okay? So you see people in cancer treatment, okay, and there are some people just very inspiring, and you just wonder, why are you so inspiring? And then there are others who seem to be so despondent, so negative. And there's all kinds of reasons for that to be going on, no doubt. But sometimes if you talk to the people who are absolutely dying physically, you see every evidence of it. The tests are all wrong, but they're still very positive and very strong. It's because they have a sense that they are more than the body, and even though it will eventually go under in one way or another, that they still exist. And so that makes it, they're more than what's wrong with them. Okay, and so it's interesting to find out with patients, what are you, what's the more of you that may not be actually part of a visit. They made the distinction in the video, and it's really good, about religion and spirituality. Religion really is just it's an institutional view. It's what you have a faith tradition. There are many faith traditions in the world. They have certain prescribed behaviors, activities, things that they do. And they also have an accountability and responsibility. So religion is structured, and there's responsibility and accountability within it. That's why a lot of people don't like religion per se, because they don't like that accountability, responsibility, or the guilting that goes, if you don't do this, there's something wrong with you. And so that part is rejected by a lot, and that's true in the world today. Spirituality, on the other hand, is not that. It's maybe even broader. It's the intangible and the immaterial. Can't get your hands on it. Not associated with any particular group, but it's the feelings, thoughts, experiences, behaviors related to a person's soul, or who they really think they are, their essence, or their search for the sacred or for meaning. It has few requirements. A person has a spiritual sense regardless of what the rest of the world says. Okay, they come to that on their own. Almost all the research that looks at religion and spirituality in healthcare or any other kind of venue pretty much assesses religion. It's very difficult to assess spirituality per se because it's so broad and kind of nebulous. But the religious piece gets assessed, and they look at, like, do you attend a religious service? How frequently do you, frequency of private religious practices that they would do? Use of coping mechanisms like praying, trusting in God, turning problems over to God, or meeting with a clergy member, or just their internalized religious commitment. What is my commitment in here? That intrinsic religiosity. Those things are what are researched. You can ask people those questions. Spirituality is hard to look at, so when I give you these statistics from religion and spirituality, it's almost all based on asking these types of questions that people can say yes or no to. So when you look at the elderly in the United States, about greater than 90% of older people consider themselves religious or spiritual. Okay, put it all together. Okay, 6 to 10% are atheists and do not seek meaning for religion or spiritual life. So that's an important element to know about your patient. You do have a spiritual understanding or not. If I've had an atheist, it's like, okay, we just, we move on. We deal with things in a way that they understand reality. About half of all elderly people attend religious services at least weekly, and the elderly's level of religious participation is greater than any other age group. And I think just from our own experience, that is probably true, that you will see that. For the elderly, the religious community is the largest source of social support outside the family. Involvement in religious organizations is most often their most common form of voluntary social activity. That's why in Oklahoma, I always want to ask people, if you get in trouble, where do you get help? Who do you turn to for help? What is your support group? Very often you would hear the church family. Sometimes it's just the family, but very often it will lean in this direction. But for the older person, it's a huge part of their social support structure. In fact, if you've had a person who has a religious orientation or spiritual orientation, but they have felt alienated from their church for one reason or another, and things can happen, that's really kind of a devastation for them, because that's their outlet, and they are now, kind of out here, and they are missing a lot of the social activity that they could have. So that's, when I hear that, that's always a tragedy in my mind for that person, because it has such meaning for them. Now, what are the benefits of religion and spirituality? Well, first, it correlates with improved physical and mental health. Just a fact. Religious people may believe or propose that God's intervention facilitates their benefits, so that the good things that happen to them physically are because God has blessed them. And we can get into a huge theological discussion about that, but we're not. But regardless, the belief is part of their sense of wholeness and being okay. And that's how they attribute their existence and their change in existence in health and in disease. Psychological benefits. There's 3 psychological benefits. A positive, hopeful attitude. See, if you believe in something beyond yourself, then when yourself doesn't exist like this, you're still here. Okay? You still go on. So that's important. Positive, hopeful attitude is good medicine all by itself. Okay, so it predicts a better medical outcome. A sense of meaning and purpose in life affects health behaviors. If you believe that you have value and that you have worth for somebody and that it's important that you're alive, you do things. You'll take care of yourself. If, on the other hand, you feel like you are worthless and nobody cares anything about you, and it doesn't matter whether you're alive or dead, take, for example, a drug addict or an alcoholic who's lost all relationships, and they come to this point of despair and hopelessness, they're not going to do anything for themselves predictably because they don't believe they're worth it. Okay, so you have to see that in their sense of self. And then it's a greater ability to cope with illness and disability. If you have an underlying belief that a higher power is with you, and that your course is directed by a higher power, and that the higher power is benevolent, it is not going to take you to a bad place, even though it may be defined as bad in the moment. Dying is bad. In their reality, it may not be bad. Okay, it's not good as a person in this existence, but it might be okay in the larger scheme of things, in their view. People who use religious mechanisms are less likely to develop depression and anxiety, and they tend to recover from depression more quickly if they have this sense of hope and a higher authority or power. Okay. In the elderly, active involvement in a religious community correlates with better physical functioning and health. I only mentioned a few groups here. Some religious groups, for example, Mormons and Seventh-day Adventists, advocate behaviors that enhance health, such as avoiding tobacco and heavy alcohol use. And different religious traditions have things you can eat, things you shouldn't eat, things you should drink, things you shouldn't drink, and that's just around the world. And a lot of these limitations or restrictions have to do, they're certainly beneficial for health, but they also have to do with your sense of your body is gifted from above, and you should not destroy it, by behaviors. And that is common across all religions too. Members of these groups are less likely to develop substance-related disorders, and they live longer than the general population. Okay, just facts. There's other benefits of religion and spirituality. Religious faith benefits caregivers. Okay, caregivers, we've talked about how they can get beat down and worn out taking care of older people. It's certainly a reality. So a religious faith for them also is beneficial. Religious beliefs and practices foster development of community and broad social support networks. For those who were raised in Oklahoma, you know the church community comes to the aid of those who have needs. So if someone dies, people go make meals, they go take care of things. If people have businesses, they try to keep them open. They will do things like that. And that is an ongoing support so that the person doesn't feel alone. It would be unconscionable in some congregations not to address difficulty. If somebody loses a family member, if someone gets really sick, if somebody has lost a job, those are things that call the network together and we help that person. Increased social contact for elderly increases the likelihood that disease will be detected early and that elderly people will comply with treatment regimens because members of the community interact with them and ask them questions about their health and medical care. So it's the community taking care of itself. I'll give you a good story about this. It's kind of interesting. When I was working on my Master of Divinity, you have all you have rotations, okay, that you have to go do. And one of them that you had to do an intercultural immersion experience. You had to go somewhere or do something that was completely not your orientation, okay? So I thought, okay, yikes, I knew that's coming, I'll figure it out. And what they usually did at this seminary is they would make you go to the border between Arizona and Mexico, and you had to interact with immigrants going across the border, and you had to kind of get into different cultures. The problem with it for me is I have sleep apnea. I have a CPAP machine. There's no electricity out there, no guaranteed electricity. Yes, you can take power packs and all this kind of stuff. But I was like, I just don't know if I can go do that because it's really, people were sleeping on the floors of churches with sleeping bags and there's no power in them. They're just like adobe, churches. So I thought, I don't know. And I had a really good friend from Duncan, Oklahoma, and she had a terrible back. I mean, it's really bad. She has certain types of mattress she has to be on. And I was always hauling her stuff to the seminary back so she could kind of be set up just right. And she's a really good friend of mine, and Dr. Tazzy before that and even after that. So she said, I just don't think I can do it. And I said, okay, let's go talk and see if we can figure out something that will work better so that we don't have to stay places that we can't do well. So they let us do it, and we had to find it, but we did find it. So we ended up being a part of the Seminole Indian Nation in Wewoka. Okay, so that's in the middle of the county that's the Seminole Nation, Seminole County, and we were down there, and we would go for the weekends, and they had these huge, long services. You go in at 9 a.m. and they would say, be ready, anything can happen. I said, well, when does it end? I need to kind of know when I'm going home. Well, whenever the Spirit's done. And I'd go, well, when does the Spirit usually get done? I need to kind of know. And they would say, well, it could be 3, 4, 5, 6. And I thought, good gosh. So, all right, so we got in there, and this is Native American people. I love them. Oh, they would sing songs, and it would no music played, but they would sing songs and chant. And different people would just kind of pick up the song. I didn't know anything. I'm like completely lost out here. I can't sing anyway. I just nod just like, yeah, it sounds pretty good to me. And they would just be singing and singing and singing, and it would just be kind of in the rhythmic chant, like, oh, God, Jesus. And I'd go, I got it. That one I know. They never changed the name of Jesus, but over half the congregation was diabetic. And so, they would be getting up to like 1 p.m. from the morning with all this activity. And one time the pastor got me and said, well, we just got to stop right now because I feel like my blood sugar's getting low. We got most of you out there need to go eat, so let's go eat. So they had this building right by the church. It's all connected, and they had all this food. Oh my gosh, the food. So they would eat and eat and eat, and they would take it to check blood sugars. They would fuss at each other about eating too much, and I thought, y'all worried about eating too much, but look at this food in here. It's like out of sight. So I thought it was pretty interesting that they would watch each other, and they would take people to doctor's visits, and they would be sure that folks were taking medicine. So that community was kind of all woven together, and they accepted us. Very, very nice. I just learned, okay, this is October. Probably back in the middle of the summer, that pastor died, and I am almost certain he had a stroke. I mean, he just had so much vascular disease that he would talk about. but really nice people. They just made you part of the whole thing. It was great. It was a good experience. So that was a weekend thing. Always Friday night, Saturday, Sunday, you get to come back. But I stayed in the motel room. I was not going to not have my electricity. Okay, so, but the religious network is helpful for getting people to comply and follow through. Okay, now there's some harmful effects of religion, okay, and I think we probably named those too. But let's look at religious devotion may promote excessive guilt, inflexibility, and anxiety, okay? Especially if the religious tradition emphasizes that you have to do and act a certain way, but you have not done that, then maybe there's a guilting thing that goes on, that may go on within that. My mother was raised Catholic, so I can talk about this. It's not my orientation. I'm Presbyterian. But she was raised Catholic, and she said, and she did convert after a while, because she said it's just impossible to raise children in the deep South as a Catholic, because it's not the religion of, it's not very commonly seen or practiced, and there's kind of a stigma against it in different parts, particularly back at that time. So she would say the Catholic faith is a beautiful expression, and if you do everything that's there, it's really fantastic. And I agree, because I've studied it quite a bit and understand the traditions. But she said it also creates quite a bit of guilt, because there's a lot of things you need to do at certain times. If you don't do them, then maybe you feel guilty that you didn't do that. And that in itself can be kind of health limiting, in some way. So guilt can be there, inflexibility, anxiety. Some people experience their faith tradition that way. And today's common response is just to get away from the church. Okay, that's kind of a normal response in today's age. I would say 50 years ago, 40 years ago, 30 years ago, to move outside the church community would be a stigma all by itself in some parts of the world. So it's different today, but still these things can fit in. It's still part of it. Religious preoccupations and delusions may develop in people with obsessive-compulsive disorder, bipolar, schizophrenia, or psychosis. So if a person has an underlying psychiatric diagnosis and then they're within a faith community, they may take some of those beliefs and then they transmute in their pathology, and it becomes difficult. For example, schizophrenic patients, they're one of the diagnostic elements is they're often hyper-religious with a lot of religious imagery. The first schizophrenic patient I interviewed was totally gone. Like acutely psychotic and in the mental hospital. And they said, here, you go do the mental status exam on this. So I said, okay, and they did a psychiatric history. So I'm sitting there talking to this person. He was discovered out in West Texas on a runway, airport runway, stripped naked. And his story was that, they said, why were you out there? I was asked, why were you out there naked? He said, well, God was going to come get me. God was going to send his airplane to take me to heaven. And I said, okay, did he come? No. Well, did he forget you? No. So don't pick me up before I can be taken away. So it was all religious, all into God and personhood and the devil's talking to the TV, just this kind of stuff. So if you have an underlying psychiatric disorder, that could be problematic with religious imagery. Certain religious groups discourage mental and physical health care. And you kind of know this, some of these we've talked about before, including life-saving therapies. For example, like blood transfusions, Jehovah's Witnesses do not do that. Treatment of infections, insulin therapy, all these immunologic therapies are out there right now. This is a reality. There are some people who believe if I'm going to be cured, God is going to cure me, and taking these things is not going to make a difference. And then you're sitting there bringing the medical model of health care to a person who does not believe in the medical model of health care, so what do you do? You've seen court cases pop up where parents have a child and they don't want to give the therapy to the child, whatever it is, they have cancer and it's a leukemia, it can be treated, but the parents don't want to do that because it's messing with their blood. And so then what happens? Sometimes courts intervene and consider that child abuse. And it really depends on the culture. What is the culture and what is the culture What authority does it give parents to decide, and what is a reasonable limit of belief? So you'll see that, happen. Some people do religious rituals. They pray, they light candles, they chant, they do things for healing, and that's part of their belief system. Rigid religious groups may isolate and alienate elder people from non-participating family members in the broader community. So let's say an 80-year-old woman has a son who has had an affair, and so he's outcast from the congregation, and so now the church ignores her too, ignores him, and separates them so that it's hard for the family unit to be whole because they can only be whole within the context of the church's definition of whole. Okay, so that is a conflict. Okay, role of the healthcare practitioner. Talking to elderly patients about religious beliefs and practices helps healthcare practitioners provide care because these beliefs can affect a patient's mental and physical health, as we've talked about. The elderly have distinct spiritual needs that may overlap but are not the same as psychological needs. Okay, there's psychology, and then there is spirituality. Ascertaining a person's spiritual needs can help mobilize necessary resources, for example, spiritual counseling or support groups, participation in religious activities, social contacts for members of a religious community. Okay, so it's important to figure out in some cases. Inquiring about religious issues during a medical visit is appropriate under certain circumstances, including the following. And I'm going to talk about how to bring it up if it's important. When patients are severely ill, under substantial stress, or near death, and ask or suggest that a practitioner talk about religious issues. So this is a person in a crisis situation, and they are leaning towards that or asking for it specifically. Okay, and then you can ask about the spiritual situation. When patients tell a practitioner that they are religious and that religion helps them cope with illness, they may come and tell you that. Okay, when people say, "Will you pray for me?" they are telling you that their faith tradition has a lot to do with how they feel about themselves. When religious needs are evident and may be affecting a person's health or health behaviors. Okay. Taking a spiritual history. Taking a spiritual history shows elderly people that the healthcare provider is willing to discuss spiritual topics. Okay, so just to ask a few questions, let's get out of the bag for them. Alternately, a practitioner may ask patients to describe their most important coping mechanism. If the response is not a religious one, then patients may be asked whether religious or spiritual resources are of any help. So you can kind of look at it as a coping mechanism question. Or practitioners, and finally, practitioners should not force religious beliefs or opinions on patients or intrude if patients do not want help. That's why I think it's one of those things that has to be gracefully and sensitively approached, being aware of what they're saying and what they're telling you they need. But if they are not, and you've asked in some various ways and you really don't get a religious orientation, then stay away from that, because that person is not telling you that that's what they do. And to really insist on it in a person who doesn't at all give you an opening or a clue is not good care. It's actually hurting them. They're not there. They're not at that right place. So that's not the receptive moment. Okay. Okay. So I want to show you there's a set of questions for doing a spiritual history, and you can only just select a few off of this as important. Just give you some ideas of ways to do it. Now, I thought this was pretty good. It's called FICA, not like out of your check, your paycheck, but FICA. There's a spiritual history tool developed at George Washington Institute for Spirituality and Health, but there's 4 areas: FICA, faith and belief, importance, community, and how do you address and care. So let's see what the questions are. For faith and belief, you could ask a person, do you consider yourself spiritual religious? That could just be part of working your way through questions. You don't have to go any deeper than that. Do you have spiritual beliefs that help you cope with stress? If the person says no to either one of those, you could say, what gives your life meaning? Sometimes they'll say, it's my children. Okay, that's pretty common, for people who've got children. Okay, so that's faith and belief, okay? Importance. What importance does your faith and belief have in your life? Have your beliefs influenced how you would take care of yourself in this illness? What role do your beliefs play in regaining your health? Okay, so that's another thing. So it's the importance of the belief. Some people have beliefs, but it's not that important for them in healing. Then community. Are you a part of a spiritual or religious community? Is this of support to you, and how? Is there a group of people you really love or who are important to you? So you can ask a question that doesn't even bring up, spirituality. You ask question 3. So that would give you some sense of it. And then finally, if they do have stated some type of faith, belief, or question, you might ask, how would you like me, your healthcare provider, to address these issues in your healthcare? It's just very direct. They might say, well, not really, I kind of need you to be my PA, and I'll talk to my pastor about this. Okay, now there it is. Okay, now some may say, if you want to pray for me at night, that's great. If you want to do whatever. So it just depends. So it's a very non-threatening way, very open. You decide. Just tell me what you want. You can refer to clergy. A lot of health, if you're in a bigger health system, you may have chaplains around. Integris has a group, Mercy has a group. So the bigger the place, we usually have chaplains. So you could do that if you were inside the system. When you're in outpatient clinics, not so much, unless they're kind of really big outpatient clinics, you might see that. You might see licensed clinical social workers who have a Christian orientation to counseling. There's just different types of things that are available. So you could refer. If the elderly person is confined in a nursing home or assisted living, very often clergy come around. They just know that that's part of what helps elderly people. So usually there will be services or pastors around. Many elderly people prefer the counseling to that offered by mental health professionals because it doesn't have a stigma attached to it. Sometimes people don't feel right for whatever way they want to describe it. They're just knotted up, things are not smoothed out, things are not right, conflict. And they will not talk to a mental health counselor. You just mentioned that, it's like, I'm not crazy. Have you had that before, Jessica?
Yeah.
Like, this is so common in counseling. What do you think, would you consider counseling? Do you think I'm crazy? That's the most ordinary response, like, well, yeah. You have to say, then you have to explain it and try to make it fit into something that's acceptable. But counseling can be done, and they will accept it sometimes from a clergy member when they will not accept it from mental health. But there are other people who will accept it from mental health before they'll accept it from a clergy. So it's not just a one-way road here. So, any questions? Let's kind of